Hi everyone, my name is Maria and welcome to my YouTube channel. Today, my guest is the doctor who is specializing in endocrinology and she's also working in the UK. Hi Samira, really glad to have you here.
Hi Maria, nice to meet you and really glad to be here too.
Could you please share your experience of becoming a doctor here in the UK, and is it difficult to become a doctor here in the UK, have an education and degree somewhere outside of the country?
I would say in short words, it is difficult. It takes time, it takes your efforts a lot, and you have to work a lot, and you have to be patient. But it is doable at the end if you really want to do it. And I guess the most important thing and the most challenging part it is to pass English exam, especially for people who didn't study medicine in English and who started to learn English later. GMC, it is an organization which are regulating licensing in the UK. It has strict criteria for English. Mm-hmm. So therefore, it's kind of takes time. And of course, you have to also prove your medical diploma and your knowledge by passing some exams.
And how long does it take you in general to actually convert your education in a way? Is it converting or you're just getting another one here?
It's kind of you have to pass exams in order to prove that your education is satisfactory for UK.
Right. Okay.
And how much time it will take, actually, it's really depend. For me, it took maybe around 3 years, but it was the time when pandemic came, COVID, so it's many exams got cancelled, so it's kind of difficult to say. For some people, it takes 1 year, for some people, it takes more.
Okay, so let me jump onto a very interesting topic that everyone is talking right now on YouTube, Instagram, everywhere. Ozempic, Mounjaro, and all other magical pills that can actually help you lose weight. So could you please tell us, what is Ozempic, what is Mounjaro, and what are they doing?
Okay, they are quite popular right now. Actually, they're quite new weight loss drugs, which we have over the last recent years, over a few years. So the way how do they work? They're just mimicking natural hormones in our body, which our body intestine produce when we eat some food. So Ozempic is mimicking one hormone, which is called glucagon-like peptide. Mounjaro mimicking two hormones. It's glucagon-like peptide 1 and also gastric inhibiting hormone. So they're trying to mimic our natural hormones, and because of that, they're helping to treat diabetes, and also they are helping to lose weight. Actually, the drugs from this group, they are not so new. We have these drugs, I would say, maybe around 20 years, but previous forms of groups, of drugs from this group, they were not giving so much weight loss. It's maximum 5-10%. But Ozempic and Mounjaro really changed our way how we manage excessive weight and obesity. That's why they became very popular right now.
This is what I actually wanted to ask you. Do they really work, or is just the hype?
No, they do really work. In the past, we had just medication which could help to lose 5-10% maximum. And we were very limited by options. And for example, we could just prescribe orlistat. This medication works also in intestine, but it had a really annoying side effect like diarrhea. So many patients just were refusing to take it.
Of course, yeah.
And in terms of coming to Ozempic, in studies, it showed that it can help to lose around 15% of weight, over the 6 months. Mounjaro around 20%.
Oh, even more than?
Yes.
Wow, okay.
Yeah. Also, recently, they published results of the study, which I was involved also in our hospital. We were took a part of this study. It's also combined medication. It's called cagrilintide. It's also showing around also 20%, but it's quite new.
Okay.
Yeah, waiting in the market. So I guess that's why they became very popular. And I need to say, with bariatric surgeries which we are using to lose weight, people can lose around 30% of weight. So you imagine,
Yeah,
depend on the type of surgery, and surgery has its own complications also.
easier to go with the drug
Yes.
rather than go with the
Yeah.
surgery, obviously.
Of course, there is some like indications, contraindications, like for drugs, for surgeries, and as endocrine doctors, we also consider everything, like taking history, full background, and deciding what's best for the patient.
And how quickly can people see those results? Amazing results, really.
Like, it is difficult to say because it is like individual response of the body. As I said, like in average, they help to lose like that percentage which I said. But there are some people who can lose more, or there are some people who can be just resistant for these drugs.
Really? So
Yeah.
it doesn't work for everyone then?
Yes, it does not work for everyone. And in order to say that it's really not working, we need to try over 6 months. If it does not help to lose like 5% of the body weight, so we are saying it's like it's not working.
It's not for you, basically.
Yeah.
Okay.
Yes, exactly.
And doesn't mean that when the person is taking the drug, as everyone is saying, it's a magical drug, we don't need to work out, we don't need to follow the diet, we just take the drug and we're done. We're slim again, no?
No, actually, no. In all studies also, we combined, when I say we, I mean medical professionals.
Community.
Yes, community. They were combining drugs plus dietitian advice and physical exercise. So people should not think like you just take the tablets and you are losing weight, and when you stop it, your weight will be stable. No, it does not work like that. So the aim, and which we do recommend to our patients, while you're using these medications, to change your dietary habits, change way how you are eating, try to eat healthy.
Eating healthy, what does it mean?
It's like more vegetables, like also like it depends what person was taking in the past, like how to say. Some people prone to take more carbohydrates, more sweets. Some people are just taking like meat products. So we are trying to balance them in order to have a satisfactory amount of carbohydrates, protein, and fat to make it more healthy. So, and also, of course, we need to implement in the life of the patient physical activity. Without that, it will not work. Unfortunately, they are not a magic drugs, and we don't even have a magic surgery to say, oh, you have done, and you can keep this weight forever. No.
And when you're mentioning exercising, what exactly should people do? Is it like a lot of cardio or the other way around, maybe building muscles to see the result?
I would say actually in general, excessive weight and obesity is imbalance, and everybody know imbalance between calories, what we consume and what we burn, like how much we
burn every day.
Yes, I burn every day. So in general, yes, there is some guidelines, or at least like 150 minutes of walking, etc., like minutes of exercise, etc. But in general, I would say any exercise would be helpful. In terms of like, we need to try to implement to the life of the patient that type of exercise. He will really enjoy it, and he can do in long term. Like if somebody likes walking, it's okay, or running, or I don't know, swimming, or going to the gym. It does not mean you have to go to the gym and work like just with cardio or with doing heavy exercise. And that's why I would say any type of exercise which will really help, but doing heavy exercise is really helpful in terms of keeping muscles, which I don't know if you heard or no, while using this medication, apart from fat, you can lose some muscles.
I wanted to ask you about this.
Yeah.
I actually had a question about it. So is it true?
Yeah, unfortunately it is true.
No way.
Yeah, I mean, we don't have a magical drug which can lose only fat. Yeah,
So it's burning everything.
Yes.
Wow.
More fat, of course, but you
Yeah.
can lose muscles also. And therefore, we do recommend to eat enough protein and do exercise also.
Wow.
It will help to keep your muscles.
And what are the other like side effects of it, apart from losing muscles as well?
Of course, like any drugs, there are a lot of side effects. And of course, there are contraindications, even when we thinking to prescribing these kind of medications. I need to say the way how these drugs are working, mainly they are decreasing appetite, and also they are slowing down stomach emptying. So that's why patients usually have gastrointestinal side effects. I mean, they can feel sick, they can have vomiting, they can have diarrhea or constipation. It's like more often side effects. Apart from these side effects, we have, of course, rare side effects. So it can cause acute pancreatitis.
Oh, wow.
Yeah, it's when if you have sudden severe pain in the left upper abdomen. So you need to be very careful and know about the side effects in order to get medical attention. So it can prone to gallbladder stones, formation of gallbladder stones.
What is this?
Like stones in your gallbladder.
Okay, stones.
Yeah.
Right, okay.
And it can cause acute cholecystitis.
Right.
Yeah, so also in people with diabetes, if they are taking other diabetes medications, it can cause hypoglycemia, of course. It's like when blood sugar going really down. Also, if people with diabetes, they had like a background retinopathy, so like eye problems already, it might worsen, like because if your sugar improving very quickly, it might worsen like your eyes, vision. Also, recently there are some reports of sudden vision loss, which is related with like ischemia in the arteries, which is supplying our eyes and nerves. So. And also, apart from this, there are some case reports about gastroparesis. It's when like people might have constant nausea and vomiting, and intestinal obstruction. I know it does sound...
It's so scary. Like, why do people do that? Like, why do you think people do that? Because obviously it's so hard to go to the gym. It is really hard to follow the diet, especially even in a huge city where you have to rush everywhere. You need so much energy. This is why you eat probably more than you need to, right? But all those side effects, they are, oh my God.
Yeah, I need to say that, of course, they're not so common. But I'm just saying to people, because some people think it is just like they don't take it seriously, but they really can cause side effects and serious side effects. But the good things, they're not so often, and we need to say it. And in terms of why people use it, of course, like, you know, being as endocrine doctor, we see a lot of patients with like really severe obesity, morbid obesity. And these people are really suffering. So it's like we all well know, like it's well-known fact, like excessive weight, obesity causing like diabetes, high blood pressure, heart problems, obstructive sleep apnea, stroke, dyslipidemia, everything. And in this kind of people, because of excessive weight, many of them, they might have even like knee problems. They cannot do exercise because they are limited already because of their health issues. So it's kind of like a cycle. Therefore, it's really helpful for that kind of people. Because it's for them, it's really like an option.
Absolutely.
And if we are talking about UK, even if you want to do bariatric surgery, sometimes patients have to wait around 1 year
to
have surgery.
Long.
Yeah, the queue is long. So, and also there might be some cases when a person need really life-saving surgery, but he cannot have this surgery because of the weight and anesthesia risks. So again, for this kind of patients, it's like an option.
Absolutely, 100%, totally agree with you. But when you look on Instagram, when you see people are showing how they are injecting Mounjaro, Ozempic on the camera, and they are being pretty slim. I wouldn't even say sometimes they don't, I can say that sometimes they are having extra weight. They don't. They are slim. They're looking good. Why? Why do you do that?
How to say? I would say all over the years, we had people who want to lose even more weight. So it's kind of like in the past, we had medication for weight loss called sibutramine. Maybe you heard, and then it was withdrawn from the market because of side effects, suicidal ideations.
Oh, wow.
Yeah, and even at that time, I remember like many, especially women, were using these drugs even when they really didn't need it. It's kind of a trend.
It's a trend. It's a trend. There used to be a trend to go to the gym, maybe work out, to go for a run. But right now it's a new trend, right? To be slim without much effort in a way, but with possible side effects. We should always remember about it.
Yeah, of course. We should remember about that. They sometimes, maybe they don't take it serious. Sometimes they know about side effects, but still they are going for that.
Okay.
But again, as I said, I hope like everybody trying at least to implement changes in their life. As I said, physical activity, dietary changes in order to keep the result at least.
Okay.
Yeah.
And when you're talking about the diet itself, the healthy dieting, like you mentioned, a lot of vegetables, protein, etc. I've heard there is this plate, I think it's called Harvard plate or Stanford plate, one of the American universities' plates.
I think there are different names.
Yeah.
I guess it's like how you divide on
How
the
you
plate.
divide the plate, yes. So do you know about it? How do we divide the plate?
To be honest, I'm not a dietitian to give like exact advice how to divide the plate. But yeah, at least you have to try to have some vegetables, protein, fat, and also carbohydrate. Because if you cut carbohydrate, it will not work also.
I wanted to ask you, should we be afraid of carbohydrates or we are okay with them?
No, we are okay with them. They are main source of energy in our body. But it shouldn't be like you are just taking only carbohydrate.
Yeah.
And you cannot avoid completely carbohydrates. It's like some type of diets, like ketogenic.
Yes, it's hard.
It's not healthy also because like in long term, you cannot run it. It's harmful for the body. And again, without carbohydrate, body start to use your muscles also. So it's kind of, everything should be balanced.
Should be balanced, absolutely.
Yeah.
If we say that we eat carbohydrates 3 times a day, but obviously not a portion, but like a spoon of rice, a spoon of spaghetti, a spoon of something else for dinner, we should be all right.
Yeah, we should be all right. And we should try to avoid, like what we say, it's kind of quick-acting carbohydrates.
Which are?
Which like, for example, juices, cola, chocolate, cakes.
Cola.
So if you eat rice or pasta, it is okay. But if you also, along with the main meal, you are drinking a lot of juices, of course, it's not good.
Yeah, it's not healthy, of
Yeah,
course. And smoothies, I guess, as well, if they're sweet smoothies.
Yeah.
It works as a juice, I guess.
Whatever, as I said, is like working quickly.
Should be avoided naturally. Yeah. So
but it is okay to eat fruits, for example.
Okay.
Yeah.
Chocolate?
If you are really craving once a week, yes. To be honest, like personally, I don't follow any diets. Yeah. I just try to eat balanced. If I really want, I can eat chocolate one day. But I'm a little bit like, I'm mindful, like I'm watching what I'm eating and trying to eat and change. Like
I
balance.
guess it's a good advice for everyone. Really.
Yes.
Regardless where you live, what you do, you should keep your healthy diet, balanced one, work out, or go for a walk, especially if you want to go for a walk after the meal, would also be beneficial for you, right?
Exactly.
So because your blood sugar will be balancing.
Yes.
So follow all the steps and you will be healthy and you will avoid maybe in the future Ozempic and Mounjaro, I guess.
Exactly.
So. And doesn't mean that we are living the era of body positivity and moving to the era of being slim, and being slim is a trend.
To be honest, I don't know how to say. If you say, like, as a doctors, we know that like obesity is pandemic of 20th century. So we are living in the era when, like, according to World Health Organization, like around 43% of adult people are having excessive weight.
43, half.
Yes.
Nearly half.
Nearly half.
Wow.
and 16% have obesity. So I guess like it's global-wise a problem of modern life, how it changed our life over the 20th century. We are using more cars, less exercise, and food changed. So I don't think like it will change globally to area of like slim. I guess like all the time we will have people who try to be slim, but still we will have people who will be happy with their body, with their weight. So I don't think it will change too much.
Because it feels like those magical pills, they kind of changing the perspective how we see health. Because previously, let's say 5 years ago, you can look at Victoria's Secret catwalk. You can see that their models have changed from being slim models to body positivity, where there are different shapes, different ladies. And right now, it feels that we're going back to where we were before body positivity. So I guess all those trends, they impact people through social media. People see beautiful pictures, but sometimes they don't really understand that there are all sorts of applications that can change how you look, your makeup, your body shape, everything. So sometimes people don't look the same as they look on social media. So we also have to remember. And also I think what we need to remember is that those bloggers who are showing that they are injecting Mounjaro and Ozempic on the camera, sometimes it's not true. We don't know whether they are injecting it or not. Maybe they're just doing it like empty injection without anything.
It's dummy pains.
Dummy, exactly. Maybe it's dummy and nothing is changing. But people think that, oh wow, they're using it. That's why I can use it as well.
And again, they need to remember, like the body of this blogger is not your body.
Absolutely.
So you might have contraindications, which that person does not have. So we didn't talk about contraindications. I guess it's a big topic would be. But I would recommend whenever you want to start any management to ask medical advice, have consultation with the doctor, and have follow-up on the doctors
like yourself, for example, of course.
Or any other my colleagues, because without doctor's advice, it's like you are just playing with your health and you don't know what will happen.
I actually wanted to ask you, is it easy to get it here in the UK? Mounjaro or any other peptide?
To be honest, I think 1 year ago, or even maybe 6-9 months ago, we had a big shortage of these kind of medications. In NHS. So it's not so easy, and if you are talking about prescribing through NHS, there are very strict criteria in order to be recommended and ordered this medication. But I guess in privately you can find them.
To be honest with you, before this podcast, I actually Googled if we can buy something here in the UK, and I just Googled buy Ozempic online, and I found you can just easily go to some website, do some sort of online consultation, but you don't really know who is consulting you, whether it's a doctor. Who's this person who's giving you the advice?
Usually they're supposed to be pharmacists.
Pharmacists?
Yeah,
okay.
And pharmacists in the UK are really qualified, so you can trust them. But the issue, person might give false information, for example, if they really want to get it.
That's right.
So it's again will be a responsibility of that person and taking that risk.
All right.
So it's kind of,
Yeah, it's a game. You should really think before doing this sort of injections. You should think twice. Go and see your doctor. Get a consultation. Exactly. Then the doctor will let you know whether you're applicable to this injection or not, whether your situation is applicable to it or not.
Yeah, and if there is any contraindications, and even if you develop side effects, a doctor can help and guide what to do.
Of course. Good. Yeah. Perfect. Thank you, Samira, for this topic. And I also have questions from the audience for you. I have quite a few questions. I will read them out loud for you, but please feel free to answer how you want. You want a short answer, it's okay. If you want to give a long answer, it's perfectly fine as well. So the first question that I have from the audience. Let's say I would like to lose 5 kilo without using the drug, Ozempic or any other peptide. What should I do?
I think we already discussed.
Yes, I think so as well, yeah.
As I said, imbalance between calories, what you have taken and what you burned. So you have to understand what is the problem. If you are not active too much, so you have to increase your activity, do more exercise. If you are eating a lot, of course, you have to change your diet. And of course, I encourage to all people who are struggling to change the diet by themselves, ask dietitian advice. So it's also available. Like, I mean, nowadays online, people can have dietitian advice in English or in other languages, whatever they want. So it's kind of...
And can you get the dietitian advice in NHS as well, or not?
Yeah, of
you
course.
Can.
Yeah, we have dietitians in our teams.
Oh, brilliant. Cool.
Yeah.
And I guess also GP can help you with this as well.
Yeah, GP can also help.
Perfect. Thank you.
There are special programs for weight loss. You can ask GP and they can refer for like Weight Watch and other programs.
Oh, that's great. Good to know. Thank you. Thank you. So the second question that we have, how to increase iron level in your blood?
I would say depend on the cause. First of all, we need to understand why you have low iron. So it's like maybe you are losing this iron, or it is you are not getting enough iron from the food, for example. If you are like, for example, a lot of women usually have iron deficiency because of heavy periods. So if it is this the case, you need to fix the cause. Or it might be you are losing iron because you have stomach ulcers or any polyps, colon. So you need to try to find out what is the problem. And first, like, step of management should be treating the cause. So, but of course, if you're a vegetarian, vegan, for example, you are not taking products which contain iron. So of course you need to take some supplements, and you need to understand it is because of your diet. And depend on the level of iron deficiency, and if it impacted hemoglobin level, it can be like additional taking iron supplements like tablets, or in severe cases it can be IV iron infusions. Or in very severe, when it's a severe anemia, it can be even blood transfusion.
And when you say iron food, is it meat?
Yeah, usually meat.
Meat,
yeah.
Okay. Wine?
Like liver, meat, like usually it is like animal products.
Animal products, and wine as well, red wine. Is it right? No?
I don't think so.
Okay, this is what I saw in the...
Maybe I'm wrong.
in the internet. Okay, good.
I know it contains resveratrol, but I'm not sure about iron. Maybe I'm wrong.
Maybe
also.
it goes really well with the steak. This is why they say
exactly.
it. So. Good. So the next question that we have, how does chronic stress impact your acne and hormones?
To be honest, it should be like you need to ask dermatologists. I don't think like there is direct link between chronic stress and acne. Acne, it's usually skin problem because of like excessive serum in these hair follicles and these glands.
Yes.
So, and also sometimes like hormonal problems, some hormonal problems can affect also. And I don't believe like chronic stress causing like really big changes. But again, I'm not an expert, so
so there might
I will leave it for dermatologists.
So it might be that, like you say, there is another cause that we need to investigate that is actually impacting acne, right? So like you were saying with iron, for example, or with any other situation, you have to first understand what is causing the issue, and then you can already address it. Good. The other question that we have, how to find the reason behind autoimmune thyroiditis? Yeah. I hope I pronounced it correctly.
Yeah, right, correctly.
Okay.
As endocrine doctors, we are not looking like for the cause of autoimmune thyroiditis because we don't know what is the exact cause and why it happened. So we have like some ideas. It's like genetic predisposition. It's like causing, like it's running more in families, like autoimmune thyroiditis, and some environmental factors also impacting
which is pollution
risks. Pollution, not too much. I mean, when we say environmental factors, it's like all other factors, like stress, infections, iodine intake, pregnancy in females. So it's kind of what we think is affecting. It's like risk factors, kind of. But I would not recommend to try to find out the cause. Yeah, actually right now it's also in social media. There are many like doctors, or I don't know even if there are doctors who are like trying to play on this topic of autoimmune thyroiditis. So by nutrition and changes, how to say, there are some works when they tried, for example, selenium supplements in order to help it for it. But in reality, we don't have any studies which showed like a proven effect, like, for example, this supplement helped or this changes in management really helped to prevent development of hypothyroidism in autoimmune thyroiditis, I mean.
Okay. And also, obviously, like you're mentioning, you shouldn't be going to some social media consultant. You should go and see proper doctor in the hospital who can actually give you some advice and recommendations.
Yes.
Okay.
Because sometimes in this way you might lose a lot of money, spend a lot of money.
And time.
Yeah, time, and the result will be the same.
What should I do with raised level of thyroid antibodies?
It is kind of coming to the same topic.
Oh, okay.
Like, yeah. It's again, it will be like, to continue first speech, like need to say like around 20% of general population might have positive thyroid antibodies, but it does not mean that all of them will develop a thyroid dysfunction. So that's why, and as I said, we don't have any management which really helped and which we can say, yeah, you can take it and it will really help to you. No. That's why in general, we don't recommend any management like endocrine doctors. We just do recommend, what we do recommend, it's like to check thyroid function test time to time, or if you have symptoms of underactive thyroid, it's meant if you like, for example, you might have excessive tiredness, hair loss, dry skin, constipation, memory issues, menstrual irregularity, or difficulty to lose weight. If you have these kind of symptoms and you know you had positive antibodies, in this case, you can check your thyroid function. And if it is all right, it means it's not from this topic.
So it might be something else.
Yeah, it might be something else. So in short words, we don't have any medical or any other changes which we can really help. And that's why you should not worry too much, because not all people with positive antibodies really develop thyroid dysfunction.
Right.
So you might have them and be healthy all your life.
Right.
Yeah.
Is it true that with age, thyroid hormones start declining? And if it is true, from what age we should start keeping an eye on it?
I would say thyroid hormones are not declining like, for example, female hormones when women develop menopause and they're like suddenly like dropping. Yeah. From the studies we know, like in elderly patients, we have a little bit higher like normal ranges for thyroid hormones. So what does it mean? We would say they tend to like decline. But again, it does not mean we need to treat all these patients. For example, if normal level for TSH hormone, I'm talking maybe too medically, but again, I assume the person who asks this question
would know what it means.
Would know what it means. The main hormone which is controlling thyroid function, usually a normal range for adult people is up to 4. But for elderly people, we accept even up to 7. So it means like we are accepting it. So it's kind of, would say a little bit declining, but we don't have like exact age to say, oh, you are already, for example, 60 or 50, you have to check it. No.
Okay, so there is no strict dimension
strict,
for it.
no.
Okay. Do you suggest keeping track of iodine-rich foods or any supplements that are full with iodine?
I would say it depends on the country where do you live. For example, in the UK, they don't have national fortification of salt, which we are using for cooking. Compared to, in contrast, for example, countries like post-Soviet Union countries, or in many other countries, they have programs, national like health programs, to fortify all salt with iodine. In these cases, if you are living in these countries, you don't need really to look for iodine supplements or etc. because already it is like ionized salt. It's like giving you enough iodine which you need like daily your need
intake.
Yeah, it's maximum 100-150 microgram. If we are talking about the UK, I would recommend also to buy ionized salt, and it should be enough. The only exception would be pregnant women. In that case, we do recommend supplements with iodine to help the baby. And so, yeah, you can eat, of course, like, for example, seafood, which contains a lot of iodine. But again, it shouldn't be also into controversial in opposite side when you are trying to just keep like seafood. Or, for example, I have to say, for example, seaweed. Yeah, seaweed. Yeah, it contains very big amount of iodine. And if you take it daily, it might cause problems.
Wow.
Yeah, because excessive amount of iodine is not healthy to your body, and it blocks your thyroid and it can cause your other thyroid problems. So it should be again
all be in balance.
And again, as I said, if you're using ionized salt in your daily cooking, it should be enough.
Does it mean that those theories that you can hear around us, that you have to live somewhere closer to the seaside where you can breathe with iodine and it's actually helpful for you? So it's not true then?
I guess it's myth. I mean, we cannot take it from the air, unfortunately.
So you can take it from the air. Okay.
No.
I'd love to summarize what we've discussed today. So Ozempic and Mounjaro, they are not magical pills.
Exactly.
So we still have to work out, we still have to eat a balanced diet, like we've discussed. A balanced is the word for us today. Should be diet is balanced. If you're taking supplements, it also has to be balanced. Iodine food, also balanced, not too much. So it should be the balance everywhere.
Exactly.
So peptide is not a magical drug. Also, what we've discussed, that we are not entering the area of slim people in general, and we're not leaving body positivity area because everyone is welcome, obviously. It doesn't mean that if you feel that social media is impacting you and you have to change your body just to follow the trend, don't do this. If you want to change something with how you look in terms of your weight, you always have to consult the doctor who can prescribe the right solution for you and recommend what you do with your situation, basically.
Yeah, and we are limited by time, but there are many, again, causes of even excessive weight and obesity. I didn't mention, like genetic causes, endocrine disease. So it's kind of big and huge topic to talk. So maybe we'll need to...
Another one.
So I would say just you need to see a doctor, first of all.
Yeah, so the recommendation from Samira today, see a doctor before you go and use any peptide solution that is out there on the market.
Yes, exactly.
Perfect. Thank you, Samira. Thank you for your time.
Welcome. Thank you for invitation. It was really nice to see you and be here.
Good. Thank you.